There are several stories making headlines in health news today. Joining us with all the details is In Focus health correspondent Linord Moudou. Linord, there's good news we're hearing in the fight against AIDS in Kenya.
That's right, Alex, thank you. Well, the United States has pledged $2.7 billion to help fight AIDS in Kenya over the next 5 years. The commitment more than doubles the U.S. contribution to combat AIDS in the East African country. The U.S. says Kenya has shown it can use the funding effectively. The new grant will be used to increase Kenya's budget for combating AIDS by at least 10% a year. Former South African Health Minister Manto Tshabalala Msimang has died. As Health Minister, Tshabalala Msimang's views on the treatment of the virus HIV and AIDS drew international condemnation. She was widely ridiculed for expressing a mistrust of antiretroviral drugs and promoting a diet rich in beets, garlic, and lemons as treatment. Some activists blame her for South Africa's slow response to the nation's AIDS crisis. And a U.S. study of women who had recovered from breast cancer finds that moderate drinking was linked to a 30% higher risk of recurrence. The study looked at women diagnosed with breast cancer between 1997 and 2000 and compared recurrence of the disease in those who drank alcohol with those who abstained. The study says alcohol consumption was not associated with overall mortality. And in Nigeria, a national survey on blindness indicates that nearly 500,000 adults across the country have a need for simple cataract surgery. Jacqueline Ogoli reports that the country's Ministry of Health is trying to foster a wider understanding of the importance of a yearly eye examination.
Proper eye care begins early in life, according to ophthalmologist Dr. Susu Enang.
If you have a child, for example, who sits very close to the TV or brings his book up close to read, it's an indication that he already has a problem. So it's a wake-up call for the parents or whoever the child is living with to go take that child to see an eye specialist. You don't have a reason why your eyes should be red. Maybe you've worked too hard, but your eyes have turned red and they are painful. There's a reason for you to see your eye specialist.
Eye specialists say it's very important to ensure a comprehensive check of their eyes every year to control disease such as glaucoma, the second leading cause of blindness in the world. Glaucoma is caused by the elevation of pressure within the eye. The condition is irreversible, but when detected early, the pressure is stabilized either by drug intervention or surgery.
Other things that could lead to eye problems, for example, are if you know you are hypertensive or you are diabetic. We know those things affect the eye in the long run, so you need to go see your eye specialist.
Barrister Yuletide Aku and Francesca llona each sought for help for different problems with their eyes.
And that's what I did, only to find that I had very high eye pressures, which later on changed to glaucoma. At first, because there's no eye problem in my family, I ruled it off. But you don't really have to have eye problem in your family to check, as I've discovered.
A particular doctor I was visited, he just used to examine me. At times, you tell me that the BP is high in a particular eye, but I don't know the language, till of late. I noticed that I don't see clearly. So when I went to a particular doctor, he said that I'm covered, this right eye is covered with cataract.
Dr. Enang says that some Nigerians employ unnecessary herbal treatment for their eye conditions.
I would advocate that you first of all see your eye specialist and know exactly what is wrong with you. We hear of situations where people drop things like bitter leaf. I don't know if you have an idea what that is. It's like a herb. They squeeze it and they drop it into their eyes. Some put things like onions, garlic in their eyes. It's not necessary. All you need to do is go to a proper eye care center and your eyes will be checked out for you and you'll be able to know exactly what is wrong with you.
To reduce the rate of blindness in the country, The government of Nigeria at interval offers free eye care services and surgery to people with problems with their eyes in government hospitals. From Lagos, Nigeria, Jacqueline Ogoli reporting for VOA.
The World Health Organization offers some statistics on blindness and the ability to prevent it. 45 million people worldwide are blind. Up to 80% of adult blindness is preventable or treatable. Cataracts and vitamin A deficiency are among the leading causes of childhood blindness, but the good news is blindness from infectious diseases is decreasing globally. And that's your news report for today. Alex, back to you.
All right, thank you, Linord. Thanks for sharing those stories with us. Again, remember to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa, right here on In Focus.